Good afternoon, I'm Gabriel and this is Sarah, and we're going to talk to you about the von Willebrand disease.
Von Willebrand disease is a blood disorder. There are 3 types of von Willebrand disease: type 1, type 2, and type 3. Type 1 is the most common out of the 3. People who have the disease have low levels of von Willebrand factor protein, according to the National Heart, Lung, and Blood Institution.
Currently, the background information that we have is that there's a few treatment options. There's clot promoters such as Almica and Stymate, and there's the inducing of factor VIII. The problem is that according to the FDA, Almica can cause major kidney damage, Stymate can cause blood clots in the kidneys, and factor VIII has a high risk of transmission of HIV.
Other background information is von Willebrand disease is the most common bleeding disorder. Although 1% of the population doesn't seem like a lot of people, it is actually about 74 million people that are affected by this disease. The purpose of this study is to avoid drugs that cause side effects and reduce symptoms. If we could bypass the drug side effects, we would help a lot of people with the disease.
Then our research question was, is there a way to treat von Willebrand disease by using a platelet injection, thus replacing the current treatment? And then we hypothesized, if platelets are transfused into a von Willebrand patient, will the symptoms disappear and the platelet count maybe increase?
The research method. A sample size of 100 adolescents will be taken. The age range will be from 9 to 17 years old. There will be an equal amount of type 1, type 2, and type 3. A single blinded experiment will be conducted, which means the researcher will know whether the patient is receiving a placebo or a platelet transfusion, but the patient will not know what they are receiving. There will be 8 treatments over an 8-week period where blood will be taken from each of the patients. And after the 8-week period, the patient's condition will continue to be monitored following the 8-week treatment period to see if their blood platelet count has maintained the same or even furthermore increased. The role and responsibilities of the researcher is monitored by the Belmont Report. The Belmont Report was issued in 1979 to explain the fundamental ethical principles. Using the Belmont Report, it requires us to provide a form of consent and a proxy since the children are underage. Patients will be allowed to be taken out of the study at any time to protect them from any risks, and there will be a random selection process to choose the patients in the sample to make sure that we aren't biased in conducting the study.
In conclusion, the impacts and implications of this study are that we could possibly use this method to possibly treat other bleeding disorders, and it would help von Willebrand disease patients live a life without fear of, for example, bleeding to death, or parents that have kids with von Willebrand disease be able to play in the playground without having the fear of their children being in harm's way. And also, in conclusion, that this would also benefit a lot of people by lifting a great financial burden on them. Thank you.